So, and especially like for various other reasons that we see patients here, for UTIs, other urinary issues, sometimes they have blood clots in their bladder. It just takes time for it to make its way out.
So for something of this size, like optimistically, I love these words today, if it truly is just the blood clot that's causing all of these, how long would that take to pass? Because I have no idea, like, size-wise. Everyone keeps saying very large, larger than things we've seen before.
So, and the bladder is, I mean, not that large to start with.
Yeah.
So several centimeters. It's probably like this size, which is large when the bladder's like this size.
That's like
so
2/3 of it.
Yes.
Okay.
So yes, it's large relative to the bladder, and it could take a couple weeks.
Okay.
And this is all assuming that that's his issue.
Yeah.
Given that he didn't have any of these clinical signs prior to all of this.
This
is
has been
all
so fast.
Yeah. So, I mean, that's kind of our best case scenario and the most likely scenario at this point.
Can you tell me the worst case scenario though, please? Because I also think like with his weight loss and I mean obviously seeing blood fall on one doesn't make me feel like you know.
Yes.
Like could this be an end of life type thing? And if so, can you explain more about that?
Yeah. So yes, it could be, given that we aren't 100% certain that this is a clot. So if this is something else cancerous, even if that's not a cancerous mass, if there's some reason
That I know they did the blah blah blah, and they said it's a blood clot, not a tumor. But did they rule out if there were any other masses or anything that would be considered looking at in his bladder or anywhere else, or was it very specific to that?
So Dr. Bauer's done several like abdominal ultrasounds, but basically what we call BAS scans, basically what that's looking at is we can evaluate the bladder, we can evaluate the gallbladder and like some specific organs, the spleen, and look for free fluid in the abdomen, which would be signs of if he's bleeding into his abdomen, like out of his organs, which he has had no signs of that.
It's all clear now.
To get more detailed ultrasound, it would have to be done with an ultrasound